Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. My name is Linda Prabarini. I am the second semester student of Medical Record and Health Information Department. Here I would like to present some information related to about quantitative and qualitative analysis. And then in this special occasion, I would like to present about quantitative and qualitative analysis from the two example of medical record template. Before that, I will explain the general concept of analysis quantitative medical record data. Okay, before I will to share screen about material. Okay, I will explain about general concept of the qualitative and quantitative analysis by me, Linda Prabarini. Okay, medical record. 1. Patient care management to document the patient disease course and treatment during each episode of care. To communicate between doctor and other health professionals who provide care to patient. To inform healthcare professional providing substance care. 2. Quality review to evaluate the dedication and appropriateness of treatment. 3. Financial reimbursement to support treatment facility insurance claim health and patient. Next, quantitative medical record analysis. 1. Determine if there is a deficiency so that it can be corrected immediately when the patient is started and the deficiency item has not been forgotten to ensure that effectiveness of the content of the RM in the future. What is meant by correction in improvement and accordance with the actual situation. Number 2, to identify incomplete parts which can be easily corrected by the existence of a procedure. Next, quantitative analysis components. Components 1. Patient identification. Components of patient identification, namely name, place, date of birth, age, gender, full address, and others. Component 2. There are all reports or not there are important review of necessary reports. Example, patient history sheet, physical examination, progress note, clinical observation, disease summary. Certain sheets sometimes exist depending on the patient case. Example, operation report, anesthesia, result. It is important to have a record date and time because it's related to billing rules. Next, component 3, authentication review. Identifiable signature stamp or stamp, an initial in a medical record, or a person. Code for computerization, there must be professional degree, such doctor, nurse, if written by a doctor or deputy or a student. Then, there is the author signature plus countersigned by the supervisor. It has been reviewed and carried out instruction from related person or have been examined by related parties with information and name, initial and details. Next component 4. Review of record. Incomplete and unreadable record. Checking line per line, and if there is an empty line, it is outlined so that it is not filled with block. Abbreviations are not allowed if there is a recording error. The wrong part is outlined and the not it is legible. Then a statement is given on the side that the note is incorrect or wrongly written another patient medical record. B. Qualitative medical record analysis. A review of medical record filing related to consistency and content is evidence that the medical record is accurate and complete. Qualitative analysis is more in-depth than quantitative analysis in 1. Support the quality on information. 2. Is an activity of risk management. 3. Assisting with more specific disease and action codes, medical research, administrative studies, and for prevention. Next, qualitative analysis components. 1. Review the completeness and consistency on the diagnosis. Diagnosis is admitting a diagnosis, reason for admission to care. such additional diagnosis, differential diagnosis, preoperative diagnosis, postoperative diagnosis, pathological diagnosis from the result of the PA, clinical diagnosis cause of pain, etiology or function, final diagnosis, clinical diagnosis and procedure, the main diagnosis, principal diagnosis, second diagnosis, secondary diagnosis. 2. Review consistency of records. Such consistency is an adjustment or compatibility between one part and another part on all parts. Diagnosis from the beginning to the end must be consistent. Record must reflect the development of information about the patient condition. And the others, I cannot to reading all because time. Okay, next 3. Review records of things done during treatment and medication. Medical record explain the fit condition during treatment and must have all the results of the examination and record the action that have been taken to the fitting. Example, normal test result fit in good condition. The patient has been given an explanation and instruction. All of the above must be noted so this condition in error. Next, 4. Review of IC listening. A statement from the patient for a treatment should be drawn carefully. Doctor must be encouraged not to just comply with the regulations such as explaining the side effects of drugs that might arise. It's necessary add a statement later. Next, 5. Review of record-keeping practices. Time of recording must exist. Easy to read, good reading that English must be durable. Reading is done careful and completely. Use common abbreviation must be legible, clear, straightforward. No readings, comment, or things that have nothing to do with the patient treatment. 6. Review methods that could potentially lead to claim for compensation. Medical record must have a record of event that can cause or have potential claims to the healthcare institution or service provider themselves, but by patient and by third parties. Next, comparing analysis of qualitative type and qualitative medical record data. Okay. Next, the template will be qualitative and quantitative analysis. Let's go to the next point. It's about example of medical record document from independent analysis. Before that, I want to explain about first the quantitative analysis from this template comparing analysis of quantitative medical record data. Okay, you can see there are some points that should be critically analyzed. In this point are components, okay, are name, number medical record, gender, nursing note, doctor record, initial medical assessment, nursing assessment, integrate progress note, and other like doctor name, doctor signature, etc. Okay, second, we are going to have qualitative analysis from this template. Okay, comparing analysis of qualitative medical record data, you can see that there are some points that should be critically analyzed. Is these points are components that are entry, outdate, diagnosis, time entry problem, medical history summary, physical examination, supporting examination, and others. Next. Okay, next. The template will be for qualitative and qualitative analysis. Okay, let's go to next point. It's about example of medical record coming from independent analysis. From this example, of medical record that we can know that in medical record is both qualitative and quantitative component. For example, that template on the right, there is the name, birth, address, education, work, religion, gender, and the others. Um, in in here, it can be our rooms page, medical record number, examination of vital signs such as blood pressure, pulse, respiration, body weight, height, body temperature, and history of disease. Actually, there are quantitative and qualitative components between the right and left templates. For example, in the template on the left there might be more dominant qualitative. Okay, next. Component but there also name and gender which are component of quantitative. While for the template on the right may be more dominant in a quantitative data but sometimes also include disease history which is qualitative component. So basically in a medical record document there must be quantitative and qualitative components so that percentages of medical record that can be balanced because the two components complement each other and become is a reusable unit in the patient medical record document. Okay, I think that's all of my presentation. I hope that it will be beneficial information for you all. Okay, I think my presentation is enough. Thanks for your attention and thank you for your attention. That last I say wassalamualaikum warahmatullahi wabarakatuh.